Hey guys, I had a client come to me recently and her mother passed away, I think the couple of days before, and I could tell, I was even balked at even asking her how she was. I could tell she wasn't good, and it just come out of my mouth, "How are you?" And she's like, "Oh, my mother died and she nearly lost it walking down the corridor." And I just put my hand on her back and said, "I'm really sorry to hear." One thing that about death, if someone says that someone's died or something's died, the animals or whatever, the best thing you can do is just hold space for them. That means that you're not giving advice. You're definitely not giving advice, actually. That pisses people off. Why it pisses people off is it's not honouring the space that they're in terms of like the grief they have. It's not your place to take away their grief, and you can't really. They're in a certain, like a death is quite a significant thing in people's lives, of course, and so that grief has quite a special place in that person's psyche. So you're not trying to take it away. And one of the other things that people often say, and you'll notice it, and you might have noticed in yourself, because I used to do this myself, is you say "at least." The worst thing you can say when it comes to a death is that "at least." Well, at least they died peacefully. At least they're out of pain now. At least, he was old, had a good life. It takes away the, I guess, the specialness and the impact of it. And it's like, at least, it's like it's not honouring that person who has died. And it's quite a subtle thing, but it really, when people have died, when you start hearing it, if people are saying "at least," it means they're not comfortable with death, which not many people are. So your role as a massage therapist, if you're comfortable talking about it, they want to talk about it, let them talk about it, let them cry if they need to. And you're not trying to stop them crying. Some people say, in counselling in particular, if someone starts crying, you don't touch them, because it acts like a form of rescuing to that person. And a lot of the grief that people have and issues they have is because people keep trying to save them and rescue them. And it sort of it doesn't allow them to fully express whatever emotion is coming up at that time. I'm in two minds about that. If someone starts crying in the room with me, I'll put my hand on their shoulder and say it's okay it's okay. I'm not trying to stop them crying or whatever they need to do. But it doesn't sort of sit right with me to not touch someone when they're crying. But I think in psychological literature is like you don't touch them, but we're not counsellors in that sense. So I feel it's okay, and it's a nice thing to do, and what we do is touch anyway. Other thing is, if you tell the person isn't sort of comfortable, it's okay to crack some jokes as long as it's in good context or whatever. I hope that helps, guys.